There are various different ways that general practice can utilize tools like SystmOne to have amazing impact in general practice. And in this episode, I'm really happy to be joined by the team from TPP and member practices that are using SystmOne to enhance the care that they offer to patients, both in terms of triage and access and their operational efficiency. And we're going to showcase what they can do and give you the chance to vote who does the best across the country for 2026 as we tech enhance your primary care and learning. Let's get cracking, shall we? Hello, General Practice, and welcome to this episode. We're really happy to be joined by various members of primary care and the team from TPP as we showcase the TPP SystmOne General Practice Excellence Awards. And we've got an amazing episode ready for you to showcase what the breadth and depth of the things that happen in general practice are, and potentially show you what you can do in your practices as well. We're going to go through what we're going to cover in a second, but I just wanted to have a quick shout out to the team that are joining us. As you can see, we've got various people here. So we've got Kira from TPP, Kirsty from Ocimum Health, Chris joining us from Harewood Medical Practice. No, the order's gone a little bit funny, apologies. Yeah, and there we go. Katie from Healthcare First, Liam Knight from Steel City General Practice, Dr. Mo Marnie from Leylands Medical Centre, and Will Moyle from Topsham Surgery as well. And they're going to showcase what they are doing utilising SystmOne and various other aspects of the care to help enhance what they can do for their patients. So, Kira, how are we doing there, first of all?
Good, yeah. Thanks, everyone, for joining. And I think on behalf of everyone from TPP, just wanted to say a huge thank you to all the practices that submitted an entry. It was a lot tougher than we'd anticipated to narrow it all down. The quality was a lot higher than we'd expected. But it's been really great to see how SystmOne has been helping practices deliver sort of the kind of care that the NHS long-term plan talks about, and all within one system as well. We've got loads more to come. So if I just quickly share my screen, if you could pop that up for me.
Yeah, you're ready to go.
Cool. So yeah, so I mean, there's the dates on there. So key dates and deadlines for each remaining category are on the screen now. So we've got loads more to come. But for now, we're really looking forward to hearing everyone today present their sort of shortlisted entries. So thanks, everyone. And yeah, don't forget to vote.
Absolutely. And just with that, just to highlight some of the other awards that you've got coming up. So in a few weeks' time, we've got the Excellence in Caring for Long-Term Conditions Award and the Gold Standard Practice Prescribing Award. Both of those, the deadlines for those are the 18th of March. So you've got a couple of weeks to still submit, and the links for that will be down below in the show notes, and I'll put them on the chat in a second. And then the webinar showcasing those, people who have got through will be on Wednesday, the 25th of March, right before the Easter break. And then following that, after Easter, we've got the Best Innovative Use of SystmOne Award and the Neighbourhood Teams Excellence Award. So submissions for those will be the 7th of May, and then the live stream for that will be the 20th of May to showcase the winners of those particular awards. So do keep those dates in mind. You can see the QR codes are there, and I will put the links to those in the chat and the show notes afterwards as well. But we're going to get cracking now, and where are we? I'm just going to bring on some of our team. So 2 seconds. This is the fun bit of utilizing StreamYard and stuff. So got myself and Kira here, and we've also really happy to be joined by Kirti Singh from Ocimum Healthcare Limited. And you're going to be showcasing us as our first candidate for the Access and Triage Excellence Award in terms of how the team are using SystmOne and System Connect to basically manage patient flow and help with access and triage, which I know is a key thing in the light of the new GP contract as well. So, Katie, welcome to the stage, and I believe it's your first time on EGP Learning, so take it away.
Thank you. So I'll start with introduction. My name is Kirti Singh. I'm a GP at Ocimum Healthcare Limited. It's a group of practice operating across 2 sites, Malzed Road Medical Centre in Luton and Ivan Medical Centre in Biggleswade. And together we care for around 24,000 patients. Today I wanted to share on how we transformed patient access across both the practices. They're 2 very different communities with very different needs. But before I talk about the technology, I just wanted to start with something more fundamental. This project was wasn't just about a digital tool. It was understanding our needs. It has been there for quite some time, but we weren't doing anything about it, and how we have transformed our journey. System Connect gave us the means to act on that understanding, and the results have been transformative. Both our practices were running entirely on telephone access. Unlike, I think, any practice in the country, 8 a.m. every morning, the phones open, and within 15 to 20 minutes, sometimes half an hour, same day appointments were gone. Every call after that was a difficult one. Staff were bracing themselves not for a clinical conversation, but for frustration, for complaints, sometimes for deeply upsetting interactions, simply for being the person answering the phone call. We knew something had to change. We took over a new contract that was in Biggleswade, 13,000 population, very different to our Luton contract, different challenges. Luton, urban, high demand, diverse population, rapidly changing population. So we're in middle of the town center where population keeps changing. Biggleswade, more rural, older patient profile, and further to secondary care. So the location of Biggleswade is Bedford, is our secondary care hospital, about 10 miles away, and then Lister Stevenage Hospital, so quite further away from secondary care and any urgent care center settings. So both sites were planning independently. There was no common intel, there was no shared data, no shared picture. Each trying to do their best in isolation. System was functioning, but it was under strain every day. And the patients who needed us most were not, it was inconsistent. Our approach was inconsistent. We were literally firefighting with everyday need. When we implemented System Connect, we made a deliberate choice. We had SystmOne before, so it kind of fitted in perfectly with what our staff and our clinicians were aware of. We were not going to simply replace phone calls with online forms. We were going to redesign how our front door works. At the starting point for all of us, it was understanding our people, understanding our staff, understanding our clinician, understanding our patient's need. We had some knowledge of how we worked better, but how do we transform all this intelligence into a smarter working system? One of the things that we learned early on is that not everyone on the reception team had the same strengths, and that's not a weakness, that's a resource. If we use it well, some of our team are exceptional at clinical triage, some were brilliant on phone, some were brilliant on meet and greeting the patients. Others were good at managing tasks and coordination. So rather than asking everyone to do everything, we structured each day around what people did their best. Early morning roles were allocated, a dedicated System Connect triage lead, a dedicated phone team, some managing walk-ins, and some on urgent tasks. People were placed where their strengths mattered. When we identified someone who's struggling in one area, we didn't lead them there. We moved them to where they could succeed. What we did was a monthly audit of each individual's functionality. That helped us to develop their roles within the team. The approach has built a genuine confidence across both teams. Our reception staff are now triaging independently. They didn't have clinical knowledge before. They had some knowledge because they've been working for some time, but they were not using that knowledge effectively. Initially, when we started the platform, our duty doctors invested a lot of time and efforts training our staff alongside the reception team, the pharmacists, our paramedics, to answer the question, queries, and it transformed. So we gave over whilst we were doubling up, and there came a point that they were doing all the triage effectively, independently. Whilst we were making all these changes for the patient's access, we redesigned our appointment architecture. We changed our slot types, corrected slot types for same-day follow-ups, NHS 11 redirections, previous day overflows, and telephone consultation. Let me just change my slide. Every day that came, it triggers, every form that came, it triggered a holistic review. So staff don't just action the presenting request, they check for outstanding long-term condition review, overdue blood test, preventative care. They learn how to navigate starting from the home screen of the patient. A lot of my colleagues will know how important it is, as soon as we open a patient record, is to read what it presents on the front page. Our staff was literally answering the phone call and effectively just working as a receptionist and as a telephone call handlers. What we changed when we implemented this system is staff to understand, to read the system better, to navigate the system more effectively. We also didn't use System Connect just out of the box. We built forms around what our patients were actually asking for. And I'll give you a few examples. We created a minor illness pathway form, a blood pressure monitoring form. Again, we're aware when it comes to cough or chronic disease management, sometimes simple blood pressure elements are missing, and there can be thousands of patients where blood pressure is missing. We created form individualized according to the need and our chronic disease reviews. Patients loved it, especially in our biggest weight rural population, where patients had access issues. They were living quite far away. They didn't want to attend surgery just for a blood pressure review. They could submit their readings online. Minor illness pathway form created them, helped them to where they wanted same-day access, or perhaps a minor illness that could wait 48, 72 hours, and they could easily write, and it helped us on the other end triage, so that we were not rushing where we had to deal with emergencies and things that could wait. Every one of those forms were built because we saw a need. Patients were using the telephone for things that didn't need a phone call. We created a better route. We refined every form since based on the patient's feedback. We had patient feedbacks, again, using System Connect forms. Here, we also used an opportunity for patients who are actively using those forms to have one-to-one interaction with them to actually change and build according to the need of the patients.
Katie, if I can, so it sounds like you've done some amazing stuff with utilising System Connector and the forms in particular to help the patients.
Yeah.
How would you say was the biggest challenge in terms of setting that up, and what was the biggest reward you also got from that?
So challenge was our own way of working. We were quite traditional, especially in our biggest weight population. We were mindful, and this was a newer contract, that if we bring those changes, how adaptive will be our patients will be, or our staff. But to our surprise, it was greatly welcomed. It was a huge success. It helped us with 70% call reduction, huge staff confidence was improved significantly, staff well-being was improved significantly.
And it seems like it saved a lot of patient hours as well from that slide that you've got there as well, in addition.
It did. So on a bad day, we could have about 140, 150 forms, but we average about 80 to 100 forms in a day. And we tend to triage all forms every single day. As mentioned, we have got about 70% reduced activity, less abandoned call. The data itself is quite intelligent. So if we dynamically review our data and change the way that we work, allocating on the more busier days, like Monday, Tuesday, for us is very busy day. So how do we allocate our workforce, our appointments, more on the days that we've got access issues? System Connect has helped us significantly. Yes.
Awesome. Thank you. Afraid we are going to have to move on to our next provider and stuff, but thank you for that. And if people do want to vote for Katie and the work that Ocimum Healthcare have been doing, make sure you use the form down below. We're going to go now, however, to bring on Chris. Let's just bring him on. How are we doing there, Chris?
Hi. Nice
Good.
to see you.
You too. So Chris is joining us from Harewood medical practice. And take it away, Chris.
Lovely, thank you. So hi, I'm Chris. I'm the practice manager at Harewood. We're based in Catterick Garrison in North Yorkshire, which is a huge army base in the north of the country. Because of that, we have a very transient population. So a lot of our patients are military families. So when part of the military get reassigned to different parts of the country or overseas, lots of our patients move as well. So we can see 500 patients move at a time. Because of that, our patient demographics are very different, mainly female, lots of children and lots of veterans. We also have large Nepalese community due to the Gurkhas, and also our Afghan population, which I'll come to in a little bit. So what do we need to achieve? So very much an 8 a.m. phone congestion, we needed to relieve that. We needed to shift from a first come, first serve model to a needs-based system. We needed to stop having to report Opal 4 by 9 a.m. each day. And we needed to understand what the unmet need was. So all those patients we couldn't meet, actually they were having to travel long distances because we are in the Yorkshire Dales, have to travel long distances where public transport is a challenge just to access healthcare that we couldn't provide. So when we went live in October last year, patient and staff engagement was key for us, community involvement, lots of different things we tried. One of our big successes, especially for our non-English speaking patients, was using avatars on social media. That was really good in different languages. And then we constantly reviewed and updated the process. How we started in October is very different to how we operate now. There I just listed a few things that our patients said, on the whole, obviously you don't please everybody all the time. But on the whole, our patients actually loved it. They liked the new system. And that's helped by we've got a very younger demographic as well. So really the benefits for our practice, we now know we have no unmet need. We now access between 100 and 160 patient forms a day, and we will deal with all those every day. Improved efficiency and access, those long phone queues have gone, patients are getting to the right clinician faster. We're using our resources better, so ensuring that our limited resources like GP appointments, actually those patients that need to see a GP, see the GP, and those that can go to the wider team like nurses, physios, pharmacy, we can direct them to them as well. And also by collecting the data that we get from System Connect is a bit of a game changer for us as well. We're actually able to plan better going forward. Patient convenience, patients love it. They can now submit requests from home and from 7:30 in the morning. We've reduced the amount of patients we're sending to UTC and A&E. Again, data-driven decisions going forward. Patients are allocated appointments that they need, not necessarily what they think they want, I think is the biggest thing for us. Positive feedback from staff. We have a lot of staff that have been working for us for a long time. So changing their hearts and minds to a new system has been good. So they're really happy, which is great. And patients like the fact that they are going to get an appropriate response within that 10-hour window. So they know they're going to get a response one way or another by the end of the day. Reduced our telephone calls by 75%, which means that our admin team can go and do something else and other things. And then really the last thing was our Afghanistan refugees. So these were interpreters working for the British Army in Afghanistan. And last year they were removed by the British Army and deposited in Catterick Garrison along with all their families. Now, the biggest challenge for us, it's not the interpreter, it's the family. Most of the families don't even read and write in their own language, never mind English. So for us, up till this point, it was a case of they would come in, they would wave their arms around and we'd try and shout at each other across the desk, and we just booked them an appointment because that was the only thing we can do. Now, actually, these families can sit with the English-speaking member of the family or with their support workers and actually fill the forms in from home. And actually then we can get all the details in advance and we can actually give them the most appropriate appointments. And that's been a massive benefit for them, and the feedback from the Refugee Council has been amazing. There we go.
Thank you very much, Chris. Interesting stuff. So particularly with the work that you've done with the refugee cohort and stuff, is there particular forms that you found have had real impact with them that you were surprised with, or is there a particular aspect of that you just thought, wasn't expecting that?
I think we tried to translate things into different languages, because there's a number of languages in Afghan. And the direct translations are really difficult. So actually what we came to was actually everything in English actually works, because there's always one member of their family who speaks really good English because they're the interpreter. And also we brought in their support workers. So we work really closely with the support team, and it's made it actually seamless now.
And in terms of the impact that it's had, is there a particular part that you thought, we weren't expecting that to work so well for us, but it's just done really amazing work to help both either the patients or the practice teams?
I think it's helped the practice team as well, because if we're able to get the information on the form, that cuts down a lot of the appointment time. So we're doubling up appointments for these patients anyway, and we still do to an extent, because we obviously get interpreters involved online. But by getting all the information, so actually our staff are prepped for when they walk into the surgery, it cuts down a little bit of time. They can get to actually what they need to without a lot of the preamble. And also by using their support workers more, and the patients bring their support workers with them, and that's great, because that's another set of ears. Because unfortunately, like a lot of patients, they leave us and then they forget what they've been told or misunderstood what they've been told. And by having the support workers involved from the Refugee Council, that has been a bit of a game changer as well for both them and us.
Awesome. Thank you very much, Chris. Awesome work that you've been doing. And I particularly like it, as you can figure out from my questions, really enjoy the stuff that you've got there in terms of the non-English speaking patients and that cohort that you've been helping there. I can appreciate the challenges there, very similar to my own practice, and I'm sure reflected in many other places as well. So real learning there. If people do want to vote for Chris, feel free to do so. So that's under Harewood Medical Practice, and the links for that are coming up, as you can see on the screen, and I will put them in the chat, already have done and stuff. And thank you very much, Chris. Really enjoyed that. Right, we're going to move on to our next group. So I'm really happy to have Katie McGowan join us from Healthcare First. How are we doing there, Katie?
Good, thank you. How are you?
Oh, good. So your slides are just coming on screen as soon as I remove the other one. There we go. And you're good to go.
Okay, so I'm Katie McGowan. I'm one of the GP partners at Healthcare First, and I'm here to present our access team today. We're based in West Yorkshire. We serve about 30,000 patients, and our demographic ranges from quite socially deprived to patients that live in sort of rural areas as well. So before I share where we've got to now, I think it's important just to reflect a little bit about where we were about 12 to 18 months ago and why we decided to make some of the changes. So at that time, about 12 to 18 months ago, we were just partially triaging appointments. We just, our clinical team just looked at the same day need for appointments with our doctors and nurse practitioners. And at that time, we were using a different online platform to support gathering information from patients. And at that time, we were using patches. Something just didn't feel quite right to us, but both from an organisational point of view, but from we were getting a lot of feedback from our patients as well. So we conducted an online survey with our patients and also went out and did face-to-face roadshows with them. And it was clear that they just didn't like that experience that they were having with the online platform that we were using. They were confused about which system to use, logins failed, and they didn't like the questions that they were being asked by that tool, and we couldn't change those either. And from our perspective, we just weren't making the savings by just in terms of creating some more capacity by just triaging those same day appointments. So we made the decision that actually we needed to look towards a total triage model, but we felt that we needed a different tool to support that. So what we needed, we needed something that addressed the needs of our patients, but also allowed us to integrate our own clinical protocols and workflow pathways so that we were more efficient and created more savings with our appointments. So that's when we decided to take the leap to go from one online tool and go with System Connect to help support us when we went to Total Triage in March last year. So our slide, I've just got the one slide, just shows what happens on a patient journey throughout healthcare first. So much the same as the other practices, you know, if you choose to fill in an online form with System Connect, if you phone or you walk in, every patient is put through our System Connect forms. And what we did is we built these forms around our own workflow pathways to ensure that the request from the patient gets to the right teams internally as well. And if that request requires a clinical opinion, it comes to our clinical assessment team, who will look at the request alongside the SystmOne record and give some advice about where the patient should be seen, allowing us to try and get the patient to the right healthcare professional the first time. So that might be with us with an appointment, or we may navigate out to a community service, or we might just give some self-care advice there and then. And we're all in the same room. We have a booking team that sits alongside us, and they support us, ensuring that the patient is clear about what the next steps are. In terms of using System Connect, the information that we've been able to gather since using System Connect, particularly around demand and capacity, has been so valuable. Because of that information, we've been able to align our rotas to what our patients need. And as you can see, since we launched last year, we have had a 37% increase in our capacity, with 100% of patients needing a routine appointment seen within 2 weeks, and 93% of patients needing a same-day appointment being supported on the day. We, over the month, we process about 10,000 digital requests, and this represents the shift from the traditional phone-based access to structured online engagement. As I've said, we've already seen that increase in capacity. So by using Total Triage, being supported by System Connect, we've absorbed that rise in demand without increasing our headcount. We've also been able to show that we're able to respond to clinical queries much quicker. So we used to be around 24 hours. We now do that within 4 hours. From a patient experience, we've gone out again and done further surveys, and they now they're more happy. We've shown that patient satisfaction has improved by 5%, specifically around the ease of access and understanding what happens after they've submitted a request. And importantly, the structured design of System Connect ensures that the less digitally able patients are supported via assisted online submission or phone translation, and everything goes into the same workflow. And again, patients have said to us that you know, they're really pleased about the clarity of communication now, the speed of the response, and the perception of transparency also. And finally, just with regards to our staff, feedback from our teams has shown increased confidence and reduced stress. And by removing ambiguity in workflow, our staff have been able to more predictably work more predictably and efficiently. And our NDT now functions cohesively with a clear visibility of tasks and accountability. And then through the standardised triage and intelligent routing, we've also reduced clinician burnout, which we're quite proud of. Our staff surveys indicate that the majority of teams feel that the system has given them greater oversight, better control of workload, and improve patient safety assurance. Thank you.
Thanks, Katie. It sounds like it's been a really interesting journey. I definitely got a couple of questions. So you mentioned that change that you wanted to make, and particularly selecting System Connect to utilize that. What was the key driver that made you feel System Connect? What was the one thing, you know, if you had to pick the top one, what was that one thing that made you think System Connect was the tool for you?
The ability for us to, as a clinical team, to be able to tailor what questions we wanted to ask patients to get them to the right appointments. So as a group, what we did in the planning stage was look at the template that was there for System Connect and use what was there already, but maybe take out and add what we needed for our patients. Our patients also said with the other platform, they didn't like the questions that were asked on there. So we used some of their comments that they came back to us from the roadshows and that initial patient survey to try and tailor that as well, so that they'd be happier with the experience overall too.
Cool. And is there a particular customization, or I guess a particular form, that surprised you in terms of how well that worked when you were able to customize it? You know, I don't know if there's been that reflection from the team that, you know, one that, oh my gosh, that helped really well.
Yeah, I think we really struggled with mental health forms actually, and this sort of, should we see everybody on the same day? Can we plan a bit further ahead? And we actually really simplified the form to just a couple of questions actually, which made it very quick for us, because some of the members of our team were getting quite bogged down with just seeing same day mental health stuff. But by adapting it to what we felt we needed, we've been able to sort of allocate same day routine, something a bit in between, and share it amongst the team, so they feel a lot better and less stressed by that.
Okay. And you mentioned having the data as a result of utilizing these systems and stuff. What was the thing that surprised you the most about the data for your last question? What we've been able to do with modern general practice, we've been asked to look more towards planned and routine care. So when we first went into this, we were looking at, you know, trying to put a ballpark figure on what our allocation should be to same day and routine appointments. But what System Connect has allowed us to do is to see actually over time where we need to put the resource, not just in terms of seasons of the year, but also over the week as well. So being able to tally that to the beginning, you know, Monday morning, isn't it? But we can flex our rotas to accommodate what our need is for patients. Awesome. Thank you. And thank you for that presentation. So if people do want to vote for Katie and for Healthcare First, then make sure you fill in the form. Again, that's coming up on screen, as you can see there, and it is in the chat. And I'll make sure it's on the show notes as well. Thank you very much, Katie. So that does cover the initial award, which was the Access and Triage Excellence Award. So make sure you vote for those particular categories. And after that, we've had the three different practices showcase what they've been doing. So we had Ocimum Healthcare Limited, Harewood Medical Practice, and Healthcare First in that particular order. So please use this opportunity to vote. However, we are going to move forward into our next award category, which is the Operational Efficiency Award. And interestingly, by my brief YouTube poll, this is the one that most people joining us live seem to want to see. Make sure if you're watching us on the recording, you get the opportunity to watch back and see some of the other ones as well. But we're going to get cracking first of all. And I'm really happy to have Liam Knight join us from Steel City General Practice. I think I've said that correct, haven't I?
Yeah, that's right. Thank you very much.
And I'm really happy to showcase what they've got planned for us. So, Liam, your slides are on screen and your timing starts now.
Hi there. Yep. So Steel City Practice is a practice based in Sheffield. We're split across 3 sites. And I wanted to show you the quality improvement project I've been working on, which is about how to manage pathology reports. This was quite an issue at our practice. The way it works is that it's one GP's responsibility to process all the pathology reports, and they manage the pathology reports from 5 p.m. the previous working day up until 5 p.m. on the day that they leave. Now, if you have a particularly busy day, if you've got extended access open, that can be up to 300 pathology reports in a day. And, you know, having done it a lot, you know, many times, that can become quite onerous. You know, the decision fatigue and the time that takes up is quite significant. So, yeah, we devised the quality improvement project to try and help save time, make things easy, and it was devised basically into kind of 2 parts. So the first part is utilizing SystmOne's auto review rules, and the second part was a custom visualization, which I've made to try and help GPs communicate and manage abnormal pathology results effectively. So I'll first start just with a quick comment on auto review rules. So here's a list of some of our auto review rules, which we've kind of come up with, and they result in around a 30% reduction in the number of pathology reports which have to be filed manually. Now, I'm sure we're not the only practice using auto review rules, and so I'll kind of just leave it at that. But they certainly have made a significant difference and time saving. So I'll move on next to our visualization, which is pathology communication page. So basically what is in this visualization is lots and lots of different protocols, and in each individual protocol there's a variation of different things. So it may be a preset SMS is sent to a patient. It could be that a custom template is then sent to reception to request an appropriate appointment. It could be that an appropriate formulary is presented to the GP managing the path link to enable quick and accurate and safe prescribing. So yeah, basically that's the visualization. So what goes into it to kind of show you a bit of the back end of the visualization. So that we've got a big list of SMS messages that we send to patients, which are tailored to specific abnormal results. So here's an example of one of our preset SMS messages. You can see that there's appropriate codes there. So there'll be a code inserted into the notes. These messages can be sent via text messages or email, depending on patient preference. And importantly, they're within the kind of character limit within SystmOne, because we have had issues in the past where if people send their own messages, it's not quite clear that if you're over the 300 character limit, then patients can get sent text messages which are half missing. So yeah, so we've got lots of these preset text messages. The next thing I kind of wanted to show you is we've got lots of task templates, which again are bespoke to each individual problem. And so again, this shows a task template. So if you have a patient who's got persistently deranged LFTs, the protocol will send a task template to reception for a face-to-face appointment. In the task body, it specifies whether that should be with a GP or one of our ACPs. And some of the task templates contain just an appointment request for a GP rather than both. There's a descriptor of what's the appointment should be for, and there's also an instruction for reception. So if they struggle to get hold of the patient, they've got clear instructions whether they can then delete the task or document that they've struggled to get hold of the patient and abort the task. Or in some of the tasks, it says they need to return it to the on-call GP because that is deemed clinically important to do so. As you can see, there's also a due date here. So for a routine appointment to discuss some mildly elevated LFTs, will be an appointment within 4 weeks, a routine appointment. That can be changed and is different depending on which abnormality we're we're coming across with the path links. Yeah, so I thought I'd give you a bit of a demonstration of what it actually looks like in practice with 3 different protocols. So yeah, there we go. Sorry, so this is live in SystmOne with a live test patient. These are you see in the middle columns, these are the headings for all the abnormal results. So if we've got someone who's got some osteoarthritis on an x-ray, we'll click this button. It sends them a preset text message with a code. The text message has some shortened URLs with patient information leaflet, as well as directing them to our website should they want to submit a triage form, which comes through System Connect, if they did want to discuss it with a GP. So you can click send, that goes off to the patient. The second protocol I'd like to show you is, so say you've got the clinical scenario, someone's HbA1c has come back. It's the first time the HbA1c has been equal or more than 48. So they potentially have new diabetes, but it needs confirming. So you'd click the button. The patient gets sent some information saying they need a repeat blood test, they may have diabetes. They get told that they should be contacted within the next 4 weeks. They get sent the text message, and then there's a custom task which is sent for an appointment with a healthcare assistant with a due date 4 weeks from today, and with instructions that if they cannot get hold of the patient, we need to return it to the on-call GP, because we want to be, this is a scenario where if someone's got a first HbA1c above 48, we want to be actively chasing that person up. So that'll be go to the on-call GP, and that gets sent, done. And then the last one I'd like to show you is so H. pylori. So you've got a positive H. pylori test. The patient's texted, it's coded. We send the text, and then within Ardens you get the formulary come up, so you know it's easy, quick, accurate, and safe prescribing. And we found it very, very helpful, saves time, and helps with that cognitive load if you're doing lots of path links, you know, one after another. Oh, sorry, I can't hear you, Dr. Gandalf.
Sorry, I thought I switched it off and I switched it on and apologies for that. Awesome work and stuff. And you picked up on the word I was going to use as I kind of ask you a question, really, is that cognitive load. It seems that that's going to really help with the team in terms of not only having standardized kind of processes for outputs for patients, but actually for the clinicians, helping with their cognitive load in terms of how to do things, you know, less clicks, more structured workflows and things. How was your cognitive load in setting that up?
Do you know what? This is probably more a reflection on me. It's quite mindless, quite mindful. I quite enjoyed it. I just sat myself in a room and did it over a couple of 4-hour sessions, and yeah, it was quite nice, to be honest. But I'm sure other people would find it quite tedious and repetitive.
So I appreciate that mapping work to make sure everything flows with all those different structures of the protocols, the task templates, the presets, everything. That must have taken a while to map through and work through. And then, like you say, also that unified discussion as to what do the SMSs look like for the patients and stuff, you know, an iterative process to make sure you kind of get it right in the first place. And that must have been a huge amount of work to get that done.
Yeah, I think, to be honest, everyone had kind of come up with their own little ways of saving time, but there was no kind of unified kind of thinking. And you know, with some help from large language models to, you know, get everyone's SMSs together and put them within a character limit and make sure they were in clear, plain English, shorten the URLs. You'd be surprised it actually wasn't. Once you get into it, it didn't actually take as long as it may look.
Okay, last question then. What was your favorite one?
There's one for if you've got a urine culture which is positive.
Mm-hmm.
So, you know, quite common. You'd probably have a look in the notes. Has the patient been prescribed antibiotics or not? Has the patient got hematuria or not? You click on it and it takes you through, is the patient male, female and pregnant? female, have they got blood in their urine? Yes, no. And then it brings you through to the appropriate formularies, text the patient with safety net information about repeating their urine sample in 2 weeks if they've got blood in the urine. So yeah, that's my favorite one.
Awesome. So protocol-led workflow that gets you through to the outcome as you filter down.
Yeah.
Awesome. Thank you very much. So if people want to vote for Liam Knight and for the Steel City General Practice, feel free to do so in the same form that's down below. However, we do have 2 more to show you in terms of the operational efficiency category. So let's take Liam off. And we're going to be joined now by Dr. Mo Bomani. How are we doing there, Mo?
I am good. How are you?
I'm good. So I'm just taking off Liam's screen, and I unfortunately don't have yours at the moment. So if you can share that with me, we can get you started.
Let me just do that now. Sorry. Okay.
Just while we're waiting for that. So people may remember Mo joining us from one of the previous TPP live streams. I think it was the clinical system one, was it?
It was the auto review rules, actually. Yeah.
Auto review rules. Yeah.
Sorry, Gandhi, I'm just having a little bit of trouble with Google Chrome. So you could move on to the next person and I will go in after them.
Okay, let's do that then. So I'm going to bring on Will, if that's okay. Yeah. How are we doing there, Will?
Oh, yeah. Good, thank you.
No problem. So we've got Will joining us from Topsham Surgery. And your slides are up and you're ready to go.
Brilliant. So I'm Will Moyle. I'm management partner at Topsham Surgery in sunny Devon. We look after 12,000 patients across 2 sites, higher than average elderly population and lots of multi-morbidity. So I'm going to show you our OMR template, optimized medication reviews. So our previous process, our admin team would process our repeat prescription requests, and if the maximum issues had been reached or the review date reached, they'd book a review with one of our pharmacy team. We were finding that a lot of our monitoring was outstanding and not up to date, which meant tasks were going back and forth between the pharmacy team and admin team to get the monitoring booked in and then rebook for a review. The system became clogged quite quickly, and the wait for a pharmacy appointment went up to 4 to 6 weeks. And that was mainly because of the inefficient process that we had. We also weren't utilising the different skill sets within our pharmacy techs, pharmacists, and our specialist pharmacists as well. And the capacity to undertake other tasks was limited, so they weren't able to assist as much with other non-meds review related work. We were also debating hiring another pharmacist, which would have cost us between 12 and 15 grand for a part-timer. So what we did is we looked at the current process, and our main challenge or task was how can we ensure the monitoring is up to date and complete before we book a medication review. And our admin team are amazing, but we couldn't expect them to know every single drug and all the monitoring that's required. So we created a template which is checked at the point of a maximum issue or review date being due. So it tells the team what is due, and it's based on 200 reports in the background, which are linked to status alerts based on the drugs that they're on, conditions, whether or not they live in a care home. And it creates a bit of a traffic light system. It also tells them the most appropriate member of the pharmacy MDT to book the patient with, depending what they've got wrong with them or what drugs they've got on repeat. I think the headline for this as well is 6 months post-implementation, our medication reviews increased by 52% without additional staffing or cost associated with that. And it's meant that our pharmacy team are able to take on non-medication related tasks from the GP team, which has had a knock-on impact to capacity with them and increased capacity across the system. And most importantly, it's increased our safety and monitoring for patients as a direct result. So this is a snapshot of what the template looks like. As I say, it's linked to over 200 reports and status alerts in the background, and it's split out into different sections. So this is the same template. It's just one page, quite a simple view. And it varies, there's 5 or 6 different variations which are patient specific. So at the top, it tells them, are bloods or blood pressure needed? Or in the case of the left-hand side, it tells us that this patient's either heart failure, diabetic, or in a care home. So it goes to our specialist pharmacist, and we task our recall lady. He'll make sure all of the checks are sorted for that. It then tells them what's needed. So bloods, blood pressure, and what bloods. So this is also really useful for our phlebotomists to know what order sets to request. It will show them upcoming appointments that are booked, because what we were finding was patients had a meds review booked in 2 weeks and we were booking another one for 6 weeks' time. So on this screen, we can see what's upcoming. We can amend and add in bloods or cancel an appointment if the bloods haven't been done. Tells the team who can do the medication review once the monitoring's all completed, utilising that skill set within our pharmacy techs, remote pharmacists and specialist pharmacists. And we've also created task templates, which are based on conditional logic. So we can only task Gemma, for instance, if the patient is in a report of drugs that are appropriate for her, or our diabetic pharmacist, if they're a diabetic. And then at the bottom, you get the green light. So monitoring is complete and ready to book, good to go. And at that point, the team can book the review. It's meant that everybody's doing the same thing. So there's complete consistency across our admin team. They're a jack of all trades. So they'll do prescriptions, phone calls, and everything else that the team are expected to do. So getting consistency can be quite difficult. It's also made onboarding new members of staff a lot easier when it comes to the prescription process, because the template's been purposely built to talk you through exactly what needs to be done for each individual patient. And then this is just some feedback that we've had from the team since it's been implemented. So it's much easier. It's reduced the workload across the team and increased the capacity in the pharmacy team, which, as I say, has had a bit of a knock-on and increased capacity with the GPs and other members of clinical team. It's useful both when doing the prescriptions, but also in a phlebotomy role, because it says what tests are needed and why. And the team can relay that to the patient as well. And importantly, the checks are now up to date and we can make tweaks as we go. So in the pharmacist feedback, not all blood pressure checks were being captured. So we've tweaked the tool, and as new drugs come out or we do new specialized medicines, enhanced services, we can add them into that tool and just keep building on it over time.
Thank you, Will. Awesome work. So I guess with the team, that initial setup obviously must have taken some time, but how did you then go through that process of enabling everybody to utilize the tool in a efficient way, shall we say? Was that done by the team itself?
So it was a shared pain. So the team we talked at a team meeting about how can we improve it, and we'd floated the idea of what if we could give you a template to look at and it will tell you exactly what to do. So we built it. It took probably 2 solid days to build, and we had our clinical partners involved on deciding what tests were needed. And we rolled it out in an admin meeting. We talked them through how to use it. And it was a bit of a soft launch. We added it to everybody's toolbar and said, use it if you want, give us feedback. If it doesn't work, no pressure. And within a few days, people were using it for every meds review. And 12 months down the line, they wouldn't be without it.
And I can see the obvious impact in that. You mentioned that near 1,000 med review kind of efficiency that you had as a result of that. And I guess, like you said, the thing that's harder to judge, but just as important, is the safety aspect in terms of the patients. And I guess the other one is the less of people having to come back multiple times for their med reviews as well, which is a key frustration for everyone, and a use of your appointments as well, clearly.
Absolutely. And not everyone's aligned to month of birth, are they? So actually this is that safety net outside of the standard recall process.
Awesome. So it's definitely coming down as a popular one. So just to bring on a comment now, I'm not sure if this is for yours or for Will's. It's a bit hard to tell from the timing it gets submitted, but there has been a comment of, can I buy this please? I appreciate that probably from quite a lot of people watching this right now, they're like thinking, I've seen what people are doing. I want to have access to that. Well, the TPP team will be helping to support some of that shortly. But the key thing is we do also need you to vote for a winner, but we've still got one more to go. So let's see what Mo's got for us, and then we'll show people what they need to do from there. So thank you, Will, for that. And I'm just going to bring on Mo now. So there we go. How are we doing there, Mo?
Yeah, I'm back. It's typical, isn't it? I can set up all the IT in the practice, but can't set up my own webinar.
It's not a problem. Sometimes things happen, and as I was saying to everyone as we started the live stream, it's live. Sometimes things don't work as well as they could, but it's awesome to have you here. So your slides are on screen now, and you're ready to go, Mo. And Mo's talking to us from Leylands. Here we are, Leylands Medical Centre. There we go, Mo.
Yeah, that's right. So thanks for having me. So I'm having to share this in a tab, so it's not ideal, but hopefully you can see. So I'm going to take the audience and yourself back to the triage section, actually. And you might ask why I wasn't in the previous category. Well, I want to show that even if you don't have your online consultation tool of preference, how the flexibility of SystmOne means that you can still arrange a really streamlined workflow. So we were given another OC, it was patches, and it has limited interoperability. But our challenge was to move to a triage first model for 19,000 patients. And by the end of this, I'll show how we got the average time from the request hitting the triage list to an outcome down to 8 minutes, and the average time for a clinician to make a decision down to about 30 seconds. And we did this by, it wasn't by working harder, it was by actually using the native tools within SystmOne. So we had a challenge. The challenge was transitioning 19,000 patients to the model. We had the tools given by the ICB, which weren't necessarily the ones that we wanted, but we had to make the best of it. We had a fragmented workflow, so clinicians were navigating multiple screens. There was lots of manual steps and disconnected information sources and rising burden. I think one of my colleagues used the term cognitive load, and there was definitely increasing cognitive load and administrative load, which was threatening safety, speed, and staff well-being. So what we did was we effectively engineered a workflow engine using the native SystmOne tools. So we designed a comprehensive triage dashboard within SystmOne that was taking an external product, but doing everything within SystmOne. So we had an integrated triage dashboard, which was like a single view. We had an instant consultation display that was showing the latest consultation that was submitted and getting rid of all the other noise. We had risk indicators and continuity of care indicators to help fulfill the ICB contract. And we also know that that's better for the patient, the clinicians, and the system. And we had protocol-driven automations, which I'll show you. And there was real-time capacity visibility as well, and then levels of automation that helped with the booking and communications. So hopefully you can see this. This is a streamlined view of the online consultation on the left here. And then we had a dashboard up here showing the number of triage contacts, the number of appointments, and the frailty score. And this down here is the continuity of care dashboard, which shows their last appointments. And if any clinician had seen this patient more than 5 times in the last 18 months, it would show up there. So we went from an EPR to a fully integrated digital decision platform, essentially. We now had contextual intelligence. We had live capacity tracking. Continuity and risk were sort of baked into the system. And we had the automated actions. Here you can see the action part of the dashboard, where the clinician had all the elements of the clinical record available to them at their fingertips. And there were 6 easy to follow workflows where you just had to work from left to right. And depending on which workflow you choose, you could just follow the instructions and the rest would be automated. And up here, you can see that the dashboard remains visible. We built an external signposting repository to have some consistency around the external organizations that everyone was using. If someone would say, oh, did you know you could refer here? And someone else would say, I didn't know about that. So everything now is in one place. And these community referrals for pharmacy are actually, they check the eligibility automatically when you click on them. So they will tell you whether a patient is eligible for pharmacy first or not. So you don't have to memorize 7 to 9 different pathways. We had internal signposting, so you're making full use of the extended MDT, because things were changing with R's roles, and with new starters coming in, people didn't know the repertoire of options that they could refer to. So this made it very easy, and not forgetting to let the patient know. So we built in some communications here, so the patient was engaged with the journey that they were undertaking every step of the way. To promote continuity, we made a series of easy book with yourself tools. So you could either book yourself a follow-up or book someone into your admin slot, meaning that you could see that episode of care through. And we made that really straightforward and easy for the patient, for the clinician to arrange. To plan your day as a triaging team, you have to know how your capacity is changing, especially if there's several of you there. So we built in tools using the SystmOne functionality, which every time you booked an appointment, it showed you the live number of on-the-day slots available, or the live number of routine booking links that you could send before you were going to run out. And so towards the end of the day, as they were getting a little bit rarer, you might change the way that you deal with the incoming demand. We also built intuitive tools to help communicate with the patients. And you can see here, the triage team has got it in their mind. They've got a set number of hours and they've got this work to get through, so they can bring people down at set intervals. And, you know, I used analog clocks here specifically because I think they hit the brain differently than digital clocks and make you more aware of the time. So the measured impact, I've already mentioned at the start, 8 minutes from something hitting the triage list to an outcome getting back to the patient, and 32 seconds for the clinician decision once they've opened the record. And behind the numbers, you've got improved signposting to community pharmacy, which is then freeing up our capacity to deal with more complex stuff. We've got reduced admin burden on reception and the clinical teams, and we've got the continuity and risk stratification, which is embedded in to every patient journey. The impact at scale, we were getting responses out much faster. We were making sure the patient was seen by the right service at the right time, fewer bounce back, better utilization of our in-house capacity, and positive feedback from my colleagues and from patients. So to summarize, we managed to take a tool that had limited interoperability with SystmOne. We leveraged SystmOne's native tools to get the flexibility we needed to shift the workflow away from the second tool and into the clinical record. And that was done by using intelligent workflow design. And that meant that the ICB commission tools became absorbed seamlessly into SystmOne. And probably most important of all, and my basic philosophy when I'm designing all of this stuff, is that we want the clinician's brain to be focused purely on clinical decision making and not have to faff about with all the different tools and clicks that they normally have to do. So the bottom line was that clinical focus was restored. So thank you. That's all I have to say.
No problem. Thanks, Simo. And so with that, you've created a system that works with any particular tool. So I guess if you were to change your online consultation tool, would you still stick with this, or would you look at having a tool that is more integrated, potentially System Connect and stuff and things?
Well, I think I would keep the framework that we've built, because it's literally can be drag and drop for anything that's coming into the record, whether that's a System Connect online consultation, a Patches online consultation. You know, everything we put together there uses SystmOne functionality. So I think we'd keep that framework because it's tried and tested. There's been iterative improvements, and people know the system. And clearly, as the numbers show, it's working really well. So I think I'd stick with it.
And what was your favorite workflow?
The favorite workflow, I like the pharmacy first stuff because that was directly freeing up capacity, and it meant that because the exclusion and inclusion criteria were included in there, we weren't getting bounce back from pharmacists saying that this patient is not eligible. So that was a good one, but there are many to choose from. Good
to hear. So trying to get patients to the right person at the right time. Yeah.
Yeah, absolutely.
Definitely. So thank you, Mo. I'm just going to take it off as we finish off this live stream. So thank you, everybody, for joining us. I can see we've still got many people still with us here live. And if you are watching on the replay, don't worry, you still got your opportunities to share in terms of what you can do to help understand who's doing the best in this. So as we mentioned, we've had two different categories and awards today. So we've had firstly our Access and Triage Excellence Award. And with that, we had Ocimum Healthcare going first, talking about how they integrated System Connect. Similarly, we had Harewood Medical Practice showing how they've used System Connect to manage their workflows, and in particular with non-English speaking patients with that cohort they looked after. And then finally, Healthcare First, in addition, showing the system play that they used, and as a result of that, the impact that had on appointment times and supporting patients. Following that, we then had the Operational Efficiency Award, and we've had three presentations from different practices, which include, firstly, Steel City General Practice by Liam, as he showcased his auto review and visualizations workflow to help streamline the way that they manage pathology results in the practice. Then, in slightly out of order, we had Topsham Surgery showcasing their medication review templates and flow that they have that has meant an efficiency in terms of how they manage their medication reviews for both the practice and for patients. And then finally, as you all just saw, we had Mo talking from Leylands Medical Centre in terms of how to manage a triage flow with an agnostic method using the inbuilt tools to help navigate things within SystmOne, and how that can lead to efficient workflow and particularly reduce cognitive load for clinical decisions to make sure the patient sees the right person at the right time. All of these are worthy winners from my view in terms of the awards, but I'm afraid only one from each category can win, and that winner will receive an £1,000 reward. But the question of who wins is up to you. So you need to vote, and in order to vote, please make sure that you use the link down below. Nope, not that one, that one. And I will put the links down in the show notes. So they're either in the chat or in the show notes below. This will be live for the next week or so, and you'll have the opportunity to vote in order to contribute and see who wins. We hope you had a great time in this. And the last thing I'm going to say is make sure you do join us for our following session, which is, there we go, coming on screen now for you. So our next submission dates is for the 18th of March, and with the live streams talking about the Excellence in Care for Long-Term Conditions Award and the Gold Standard Prescribing Award. So you've got your chance, if you're watching this, to contribute for those and potentially win those awards. And then after Easter, we've got the Best Innovative Use of SystmOne Award and the Neighbourhood Teams Excellence Award. And that submission date is the 7th of May with the live stream on the 20th of May. And we will be showcasing the winners over the next couple of weeks. And in particular, when you join us for that webinar on the 25th of March, you'll get to see the winners from this category. We hope you had a great session. Thank you, everyone. And as ever, we'll be here to take an answer to primary care and learning. And those next streams are coming up if they're live, if you're watching this on the recording. Catch you later.